Great, so you've made it through a lot of material so far. Pat yourself on the back. You're maybe 2/3 of the way there or so. Now we've gotten through a lot of really the less familiar parts of the anatomy. So we've looked at all of the terminology, the intro and the overview of all the joints and the bones, and hopefully all of that's pretty familiar because we've related to it in the context of the anatomy as we've went along. So you might even look back at this point to the intro and notice how much you've learned already, even if you haven't been reviewing in between the sessions, how much is starting to stick from that intro just by reviewing it as we talk about the specifics of the anatomy. Then we looked through each part alone, on its own, separately. We looked at the shoulder. Remember, we talked specifically about the shoulder being a more mobile joint, so we need to really focus on the stability of two things, right? We had scapular stability and the stability of the humeral head. We looked at two main muscles for the scapula. One, serratus. Two, on the back, the rhomboids. Then we looked at four main muscles to stabilize the humeral head. Maybe you remember the name of them as a group, as the rotator cuff on the front, subscapularis on the top, supraspinatus on the back, Batman and Robin, infraspinatus, and teres minor. So remember, their main purpose there was to juggle the position of the humeral head and the others to position the scapula anytime we're weight bearing. Then we moved down to look at how the muscles support the hip joint. And we looked at the front of the hip joint here with the iliopsoas and the antagonist to that on the back, gluteus maximus. We looked at the side muscles of the hip, the abductors, gluteus medius and minimus as a team, and then also TFL, tensor fasciae lata. We looked at tensor fasciae lata also pulling on the IT band to stabilize both the hip and the knee. We looked at the adductors and the external rotators, the piriformis and the go-go-Q muscles, and how they all work together to help stabilize the hip. Then we looked at the back muscles, and primarily we looked at two. One, to extend the spine. Remember the group of these long erector spinae muscles. And then the lateral stabilizers here, if you remember the quadratus lumborum. Then we looked at how the abdominals come together with that, and we talked briefly about how the psoas interrelates with that, also being an extensor with the erector spinae muscles. And we looked at the abdominals and their main functions. We looked at one as primarily a flexor of the spine. Remember in the front here, the rectus abdominis. This pair of obliques as our rotational or side bending muscles. And then the last one, the deepest one, remember the subtle one, as our TVA, transverse abdominis, to hold and support the lumbar spine. And then we looked at the primary muscle of respiration, right in here. Remember the diaphragm, and how the diaphragm and the transverse abdominis interrelate. So you've got a lot down, and I want you to notice that the next two places we're going to look at are going to be the leg, and then we'll finish with the arm, and a lot of this is going to be more familiar to you. So you can take a little breath of relief that you've packed in a lot of the information already, and hopefully this will be a little bit more familiar and stick a little bit more quickly, more naturally. So with the leg, first off, let's recap the bones. We've got this long bone of the thigh, the femur bone. Remember this bony prominence here, the greater trochanter, the lesser trochanter, the head of the femur sitting in the acetabulum, which we looked at for the hip joint more. But now we have this long bone, the shaft of the femur. We have the little patella, the floating patella bone. And then we have the two bones of the leg here, the shin bone here, or the tibia, and that outer bone here, the fibula. Then we have the tarsals, or the small bones, which each have their own names, but we'll talk about them collectively as the tarsals, the metatarsals, and then the phalanges, or the toes. So remember as well the movements here that we're looking at. We already looked at the movement of the hips, but primarily what we're looking now in the leg is the movement of the knee, so flexion of the knee and extension of the knee. Then of the foot, inversion and eversion, plantar flexion and dorsiflexion. Plantar flexion and dorsiflexion. Inversion, eversion. Flexion of the knee, extension of the knee. So we're going to start out with the quadricep muscles, and we're going to look at all 4 of them. And we're going to start out with the 3 that are more familiar to us. So quadriceps, meaning there's going to be 4, quad meaning there's 4 separate muscles, but as a muscle group, they're going to all come together to insert on the tibia here. So they're going to create what we call the patellar tendon. That's going to come over and insert the quadriceps tendon, which becomes the patellar tendon, and inserts on the tibial tuberosity here. So all of them will have that common insertion. Now for the first 3 quadriceps we're going to talk about vastus lateralis, vastus medialis, and vastus intermedius. And all of these are going to originate from the femur itself, from the shaft of the femur here. So we don't need to worry too much about the specifics of that, but what we're thinking about is that these 3 quadricep muscles are originating on the femur, a very powerful group covering a lot of the femur bone here to insert on the tibia, meaning that this group is going to be a really powerful extensor of the knee. And we know this, we feel this in the quadriceps. We extend the leg and we feel the quadriceps contract. So vastus medialis is going to be on the medial side of the thigh. Vastus lateralis will be on the lateral side of the thigh, and vastus intermedius will be right in the center, right down the middle. So those are going to be the main group that we look at first. And again, those are pretty straightforward. The main action here is extension of the knee, or the only action of those is going to be the extension of the knee. One thing that's helpful to notice is because it is covering a lot of the thigh bone here, it is a very powerful muscle. It's a massive muscle. In fact, we'll palpate this later, but what you'll see is it really covers almost 60% of the thigh. So it's a lot of what you feel here. In fact, if you just take your hand to your thigh right now, you'll feel this massive musculature of the quadriceps really covering a significant portion of the thigh, which makes it nice. We don't have to memorize all these tiny little muscles like we do in other parts of the body. We can think of them as a powerful group. So think of any poses where you're going to be extending the knee. Think about basically all of our standing poses where the leg is even straight or bent. So Utkatasana is one. In fact, what might be even more helpful is just to pause for a moment and close your eyes and to think of, in your practice, when you start to feel your quadriceps fatigue. It's an easy one for most of us, because if you've had a practice where you've stayed and held poses at some point in your yoga practice, you know that there's a lot of poses where we start to feel the quadriceps talking to us. So if you can just think about that without having to analyze it on the anatomy level, notice when in your practice you feel the quadriceps getting tired. And we can consider that almost all of the standing poses could potentially be involving the quadriceps to some extent or another. So especially the ones like Utkatasana where I'm bending my knees, my quadriceps are basically keeping me from falling on the floor. So they're eccentrically contracting to hold me up here, though I'm not completely straightening the leg. Right, so there's this eccentric contraction as I bend my knees and come down into Utkatasana, and you can really clearly feel the quadriceps come on. We talked about this same eccentric contraction coming into Warrior B. As the quadriceps lengthen, remember, because I'm flexing the knee, but they're keeping me from falling on the ground as they eccentrically contract. They contract as they lengthen. So really any of these bent-legged standing poses here, again, you've probably experienced this in your own practice. It's one you start to feel pretty quickly. But even potentially in many styles, in many instances with the leg straight, we're still thinking about engaging these thigh muscles so that I'm not just laying on a dead leg here. There's this kind of energetic hugging or awareness of engaging to help support us that's still happening as the leg is straight. So there's a few poses that we think of that can stretch or lengthen the quadricep muscles. And just take a moment, again, I think it's helpful, instead of using your brain all the time to consider the anatomy, to consider when you feel the quadricep stretching. So probably one of the first that comes to mind is either sitting on the heels or between the heels, which could also mean Coming back, Supta Virasana, Ardha Supta Virasana, one leg at a time. And then the other version of that could be in some traditions called Bekasana or Ardha Bekasana, one-sided, as I'm bending the leg in here, stretching one side of the quadriceps, as some good options for stretching the quadriceps as a group. Now, let's look at the last one. So that's 3 of them. We talked about quadriceps as being 4 muscles, right? So that's 3 of them: Vastus, Medialis, Intermedius, and Lateralis. Now, the next one, the 4th one, is called Rectus Femoris. Rectus Femoris is going to sit right on top of Vastus Intermedius. So it's going to go right down the center. But the difference with Rectus Femoris is it's going to be the only quadricep that crosses the hip. So it's going to come from the AIIS, anterior inferior iliac spine, just below the ASIS, not to be confused there. But remember, we had the TFL coming from the ASIS. Now the rectus femoris is going to come from just below that. So think of this as, you can remember AIIS, or just think just below the ASIS. It's a lot of letters to consider. Remember, the most important thing, you're not going to use these origins and insertions in your yoga classes, but that you have a visual of what's happening here. TFL is going to come from the ASIS. Rectus femoris is going to come from just below it. So it is going to be one of the quadriceps that also crosses the hip. So rectus femoris is not only going to cross the knee joint and help this team of muscles really powerfully extend the knee, but it's also going to cross the hip, which means that this muscle going from here all the way down to here, and we'll just consider this upper portion, can also flex the hip here. So rectus femoris is going to be a synergist for what muscle? Remember, the iliopsoas was our primary hip flexor, so rectus femoris will be a synergist for iliopsoas, and then also an antagonist for gluteus maximus. So we've got the hip flexors, iliopsoas, rectus femoris. Maybe you remember another one. We actually mentioned one other hip flexor close by. Remember the pocket muscle, the TFL, that did a little bit of a lot of things, but not a lot of any one thing? The TFL, remember, is also hip flexor. So we've got synergist iliopsoas, rectus femoris, and TFL, all being antagonists to gluteus maximus. The most powerful probably being the iliopsoas. So with rectus femoris, one of the key points to remember is that this muscle is actually going to cross both of those joints. So it can potentially both influence the hip and the pelvis, as well as the knee. Now, the other thing to consider is that it's also joining forces with these really massive quadricep muscles. So it makes it a pretty powerful extensor of the knee, but also allows this powerful group to have one point where it ties down onto the pelvis, which can also influence the pelvis. So we talked about this as a hip flexor. But think about this, if we think about this in relation to those puppet strings we were talking about. We were thinking about the muscles as puppet strings pulling on the bones, articulating us within this tension system to determine how we hold ourselves up, how we posture ourselves. So if we think about this with rectus femoris attaching to the front of the pelvis here down to the knee, you can imagine too that if this really massive musculature of the quadriceps becomes really tight and starts to pull on the pelvis, it can also influence this positioning of the pelvis. So tipping the pelvis forward a little bit here, more posturally just due to the tension, not so much from a contractile perspective. So as far as movements go, it's going to be a hip flexor and a knee extensor. But when we have a lot of tightness in the rectus femoris, it can also limit our capacity to posteriorly tilt the pelvis. Think of this in back bends. This becomes an important thing to consider in back bends. We think about what tends to happen in a back bend here. We mentioned this a little bit already, but coming into a back bend, if we don't think about setting the pelvis and the core first, right, we have that hyperlordosis and we come right into the back pretty quickly. So part of what I'm trying to do here to set up for my back bends is not necessarily to clench the glutes and really neutralize the pelvis, but I'm trying to think about posteriorly tilting the pelvis a little bit, because remember, the pelvis is the flower pot for the plant growing out of it, is the pot for the flower to grow out of here. So when I think about back bends, I want to posteriorly tilt that pot, the foundation, so that my spine can follow that. So if I have a lot of tension in rectus femoris, it can also be limiting in my back bends, because this area can be so matted and so tight as a large, massive muscle group that it pulls on the rectus femoris, making it difficult for the pelvis to tip back into our back bends, so that it becomes really difficult to find that nice, even back bend rather than laying in the lumbar spine. So one element to consider in back bends as well, clearly when we look at the quadriceps, it's not often the first thing we think about, but an important thing to keep in mind. I find a lot of times, especially with people who are athletic or even more athletic in their youth, that the quadriceps become really massive and resistant, and can be one element that contributes to difficulty in back bends. So something to consider there. When we look at the rectus femoris, remember, it's part of the quadriceps group, but as we start to target the rectus femoris specifically, what we want to consider is not just that it's a knee extensor, but also that it's a hip flexor. So in order to target it in a strength capacity, what I want to think about potentially is poses that will extend the knee and flex the hip. So you can already see one of those poses, right? Utthita Hasta Padangusthasana, extending the leg and flexing the hip there. Another one that we've talked about before, Navasana, but now with the legs straight, targeting a little bit of rectus femoris. Remember, with what other muscle did we talk about here? Right, the psoas to help flex the hip as well. And we also mentioned the TFL, which you can probably feel in Navasana as well, as a hip flexor holding us there. Now, to stretch the rectus femoris, clearly we could look at it with the rest of the quadriceps in the poses we looked at, hero's pose, Supta Virasana, all of these variations with the knee bending. But if we wanted to target more through rectus femoris, we want to not only flex the knee, but also extend the hip. Right, so you already see one here, probably. I'll turn Fred to the side. Right, flex the knee, extend the hip. What have we got here? Fred's a very good demo of this. Dancer's pose in Natarajasana. Or another one where we can target it that doesn't have as much of a traditional name here is our low lunge, grabbing the back leg. So again, targeting more of that rectus femoris, because not only am I flexing the hip, here I might target more of the hip flexors like the iliopsoas in particular, whereas now I'm really going to feel that more in the rectus femoris. If I take the hip flexion out of it, I'm probably going to feel it more in the other quadriceps, the vastus, medialis, lateralis, and intermedius. Now, as a yoga teacher, you don't need to overly think all of that. We experience a lot of that. So just by understanding some of the basics of the anatomy, you can kind of let go of the brainy analysis of some of that and just remember where you feel it. When we look at the palpation of these later, you can start to develop an awareness of exactly where they are. We've already mentioned it a little bit, the rectus femoris going right down the center, so that you can connect to that in your own practice of when you feel these muscles fatigue or engage, and when you feel them stretch or lengthen. Now, the one last thing to add about rectus femoris is that it's also a really powerful coordinator of the hip and the knee. So there is a part of it that is helping to coordinate the movement of the hip and the knee, just similar to what we looked at with the IT band, stabilizing the outer portion of the hip and the knee. The rectus femoris is going to be more looking for that coordination through the front of the knee and the hip. So a really important one for the patellar tracking, or this tracking of the patella through the center of the knee, as well as the balance of the medial and lateral quadriceps, the tone of the medial and lateral quadriceps, which will play a significant role of the tracking of the patella right down the center of the knee. So a lot of things to consider. Remember, with the quadriceps, mostly a powerful knee extensor, but we also have rectus femoris, which also plays a really important role at the hip. And together, they play an important role of coordinating the two of them together. Next, we'll look at the muscles through the back of the thigh and the lower leg.